basics of sit to stand. What do you tell a client when you say, I need for you to stand up from this chair, this sofa? What do you do?
I'll push the edge of the chair.
Excellent. Come to the edge of the chair. There's people who are sitting forward in their chairs are way better able to bring their body forward and over their feet than someone who's sitting back. Excellent. Scoot up, however they do it. Slide out, scooch out, just get them out there. What else? Works. Anything else we need to pay attention to? Feet go where, do you think? Feet go in front of the knees. Feet go behind the knees.
No, you
Feet
can't.
go one forward. Okay. It is important to think about the feet. I like to say that the feet go under the knees. Where the feet are is going to be your new base of support. Base of support is always describing where that center of gravity is going to be balanced. If my base of support is too far forward, I've got a lot of oomph to do to get there. Okay. So feet should be under the knees, or some people like to have one knee slightly back or 1 foot slightly forward. Perfect. Now what do I do to stand up? Just push and stand?
No, yeah, you gotta hold on to
Your head has to be over the knees.
Head over knees. I like to say shoulders over knees, nose over toes. Those are still good things to say. And I will add to that, for many patients who are weak or who are, what's the word I want to use? Have a hard time with their mobility, like patients with Parkinson's disease, even patients with arthritis. You might want to do a little bit of rocking first to help get them forward. Exactly right. It's called momentum. Actually, it's got a fancy name in physical therapy, but we need to go there. So we're going to go on 3. Everybody's going to stand up with me.
Okay.
Ready? On 1, 2, 3, forward and up. And once we get forward, the critical command to give your client is to push your feet down on the floor. All right? Now you're going to sit down, and you're going to sit down slow motion for me, please. Slow motion. So what does that require? It requires the knees go forward over the toes, your body stays forward, reach those hips behind you. How many of your clients go curb walk? And if it weren't for the chair,
They would be on the
they'd be on the
floor.
floor, and sometimes in spite of the chair, they're on the floor. All right. Sitting down slow motion is as important, if not more so, than learning to stand up. All right? So we're going to stand up again, and this time I want you to do something with me. Because I mentioned to you the command that I like to give your client, which is push your feet down through the floor to stand up. So it's not straighten your knees, it's not straighten your hips, it's not stand up tall, although all those things might help. Push your feet down. I want you to actively think about what that does for the energy or the movement that you are controlling right now. So again on 3, let me do it with momentum. 1, 2, 3, forward, push down on the floor. Did you feel those feet?
Yeah, that's better.
It grounds your patient, and it doesn't just ground them, it actually gives them the foundation on which they can get erect. Sometimes you give them a command that says, straighten your knees, and they go, well, where are my knees? You know, push those feet down makes the change. Now, sit down slowly and note what you've got to do. You've really got to exaggerate that bend forward in your body. Bend forward in your body. Reach your hips back. I know. You can reach back if you have to. But reach down low, don't reach up high. Because if you can imagine, what your client loves to do is to sit down with their shoulders and hips staying in one. Okay, there we go. That was it. You can never maintain vertical balance if your shoulders and your hips are in one line. they have to be bending, bending, all right? So if you were in front of your client helping them